Hey everyone, welcome to the show. I'm your host, Dr. Joseph Coppus, and today I'm joined by my guest, Dr. Jared Seigler. Thanks for joining me today.
Thanks for having me, man. It's good to be here.
Yeah, really appreciate you being on. So Dr. Seigler, can you tell us, the audience, a little bit about what it is you do in your clinics?
Yeah, so I actually already work remotely, so this is my office. And I started with functional medicine, gosh, about a decade ago now. My wife was my first patient. She was told we would never have kids and we should think about adopting. And I really didn't accept that. She was 23 at the time. Anyways, long story short, I ran a poop test on her. We found all these weird things. And my daughter's about to turn 7. So it was really neat. And her brother has Crohn's disease, and we were able to get him off his medications and everything. And I got really excited about how we could really support the body to heal. And then about, I'd say maybe 4 years into it, it was my first autistic patient. And the mom had RA, and she was like, hey, can you help my son? And I was like, I've never worked with an autistic patient before. I was like, but sure. I was like, we'll do what we do. We'll, fix the gut and all these things that you read about on the blog. So I was like, we'll do that. We'll see what we can get. And then he started to talk for the first time ever. And he's like 9 at the time. And he had echolalia. I didn't even know what it was at the time. I was like, why is he talking like kind of a parrot? He's not saying anything. He's just repeating it. And that's when I started to go down this whole, I guess we call it functional neurology, clinical neurosciences, whatever we want to call it. Right. That's where I was like, man, I know there's something more I can do for this kid. And then I learned all about oh, there's this basal ganglia, and then all of these other, once you go down that rabbit hole, you come up for air maybe every couple of years, but that's really about it.
Mm-hmm. Exactly. If you don't mind, can we dive a little deeper into your story with you and your wife and how you were able to help her out? I watched a video that you have online about how you really were able to help her out with the functional medicine side of things. And
yeah. Well, we started with the gut. It was my first stool test ever, and that was, man, a long time ago. But for us, that to me, that was kind of a real steep learning curve. But then it also helped me learn how to prioritize a lot of things metabolically. Like, how are we even going to get nutrients to the brain? What's maybe constantly activating sympathetics? There's just so much that, we can definitely wire all day long with neuroplastic therapies. But we got to get the body in that state of healing. So, she's given me permission to talk about it. We found parasites, which, just so you know, everybody listening to this, y'all have parasites too. They're not all bad though. Our bodies really evolved with them and learned how to find tolerance sometimes. It's really when we find people that have this maybe breaking point, either genetically or metabolically, and the body just can't do it anymore. So in her case, we kind of unloaded a little bit of that burden for her as far as the gut. It was a real steep learning curve because she had that SIBO, right? Too, and so it was the healthier she ate, the sicker she got. And I'm like, well, this doesn't make sense. She felt better when she ate cheeseburgers. Why is this so hard? Mm-hmm. But then once you start to learn more and more about all these things, you just see it's the terrain. So, she had her first cycle in 5 years, I would say. And then we only had one. I thought we got it back and then lost it. Cause I was like, man, but then we found out we were already pregnant that fast. And to me, that reaffirmed nothing is going to fix the body better than the body can fix itself. We just mm-hmm. have to put it in an environment where it wants to heal. And then I think personally, healing, it should seem kind of simple, not easy, but it should. I like it when patients say, wow, that was really simple. And I think, yeah, that's because we were doing what was right for you. We didn't have to try to micromanage it or force your body to maybe do something it's not really wanting to do right now.
Mm-hmm. So something I feel like I've noticed is a lot of women are having similar issues as what your wife experienced, the PCOS, I believe. and you were able to resolve her issue with, by focusing on the gut. Since being in practice and focusing on functional medicine, functional neurology, um, how frequent do you see this in your clinic, and how often do you see the gut as a major issue when it comes to what these women are dealing with?
Oh man, I'd have to say all the time. And that's because I'm biased, just because, we only see like sick people. Very rarely will someone super healthy come in and be like, I feel great. I just want to keep feeling great. So of course we have that kind of like clinical bias where, but uh, and sometimes it's a catch-22. Sometimes the gut can start it, but as we know, say for something like a head injury, that can have like severe, like very like severe, real quick clinical implications. Like they hit their bell hard enough, guts leaking in a few hours, maybe. I mean, we'd see it all the time in like blast and injuries and vets and things. So, and I know that's what y'all do. Yeah, isn't this head injury awareness or head
Uh,
concussion? Yeah.
yeah, this is Head Injury Awareness Month right now.
Yeah.
Or
Oh man. And yeah. Anyways, there's a whole lot of those, but we typically always see it kind of being involved. And that's where, because I have run like stool tests on healthy people, or what we'll just call asymptomatic. They don't feel bad. They're like, I feel great. Blood work's looking good. And maybe their stool test on paper, it'll kind of light up like a Christmas tree. And that's where it's, to me, back to more of the tolerance, especially when we think of, say, like the vagus nerve. We know that's like the lead singer in the band at this point. Everybody talks about the vagus nerve, but we know that it regulates and modulates a lot of the inflammatory response in the gut. So maybe if somebody is like, wow, I love my spouse, I love my kids, I have a great job, a great set of peers and friends, everything's great. They're in this parasympathetic state where their body's like, who cares about some bacteria? Like that's not gonna be what gets us. We have that flexibility.
Mhm.
But then people typically, we lose a lot of that like metabolic flexibility, and now we become really rigid. So then, well, now I'm responding to this food, because like when we think of PCOS, and it's funny, we were supposed to talk about PANDAS, but we can get there, right?
We'll get there. Yeah.
Yeah, but when we think about PCOS, like we think of a lot of the cell danger response and mast cell activation syndrome, or whichever you want to call it, chronic inflammatory response syndrome. We see a lot of metabolic effects, like when the body takes this entire shift on a cellular level.
Mhm.
And for those that aren't listening, think of the cell danger response. If people haven't heard of that before, it's like the initial system. The cell realizes something bad is happening. I just call it the oh crap alarm. Emotional stress can do it. Toxins can do it. Parasites, viruses, like whatever. It can cause this cell danger response. And then your mitochondria, which we used to think were like engines inside of the cell to give it energy. We know it's much more than that. They're like the first signal of the immune system. And when they used to make energy for that cell to work, they stopped keeping that energy in a cell. And now they shoot that extracellular energy called ATP. They shoot it outside of the cell like an SOS. And the immune system sees this kind of flare, and it's like, oh no, something's going on. Let me see what I can do. Um, and so that's where it's, so in my opinion, no coincidence when we see metabolic stuff, immune stuff, and neurological stuff. Because when we think like immune cells have neurotransmitter receptor sites, most of the cells inside of the brain are immune cells, or well, a very high percentage of them. So we know that the two were meant to work together. So that's where I find, at least for me, supporting somebody metabolically and through like brain rehab exercises, things like that. It's like chocolate and peanut butter. They just go so much better together than separate.
Absolutely. Absolutely. Um, and right before we get into, thank you for sharing, by the way. But right before we get into the discussion on PANS and PANDAS and potentially autism, you mentioned a story about that as well. We've talked a lot about functional neurology on this podcast, but can you talk and kind of explain what functional medicine is to any listener who may not be familiar with the term?
Yeah. The easy, like 10-second elevator spiel is, it's why somebody's sick, not what they have. So if 10 people have diabetes, there could be 10 different reasons why that's happening. One could be oxidative stress. Another person could be like actually stressing themselves into insulin resistance. You know, someone could just be eating McDonald's and things like that. So we focus on metabolically, like why something is happening. And back to like fixing the gut, you know, those three words mean a whole lot. Because the reason we typically start there with everybody, I jokingly tell my patients, like, well, the good news is it's your poop you're going to be collecting, so it could be worse. um, but that's, you know, to me the foundation, because we're meant to like get rid of waste, we're supposed to get nutrients, and when we think of like a large percentage of so many different systems in the body reside in the gut, the immune system, the nervous system. We know that's where most neurotransmitters are made, like Parkinson's and things like that. We think of, you know, toxins crawling up the vagus nerve. It's a two-way street, right? So that's where, to me, we just kind of have to start there with functional medicine. So, and then of course, changing diet's going to be big too. And I don't like to paint people in a corner. A lot of people, we don't want to make food the enemy, because we know that can be like the nocebo effect is sometimes what we call it, right? Because I think, well, what did the strawberry do wrong? Like in my wife's case, the vegetables she ate that made her feel worse. Why would we blame vegetables? We were meant to eat that sort of food. We weren't meant to eat whatever's in the box coming through a drive-through window. That's what we weren't meant to eat. So then we would really start to approach, well, what dietary changes can we have someone make based off what happens to that food after they eat it? A lot of the time that seemed to me, at least for me, to be a question that was ignored. Like, are we feeding anything down there? Because a lot of the dietary, we can call them restrictions, but modifications we might make with patients is like, hey, you're feeding bacteria or yeast or parasites. What we might call it like an oxalate diet. And someone's like, well, I can't eat spinach. And I'm like, what did spinach do? You know, if that makes sense. So yeah, functional medicine is more of the metabolic. So I know all the listeners know functional neurology. And the way I explain both is like, think of functional medicine like drinking a protein shake, and functional neurology is like going to the gym. They work a lot better. You kind of got to do both to really, in my opinion, get like the results you want for all that effort and everything you're putting into it.
Yeah, I love that analogy. That's perfect. I'm
Yeah.
sorry if I
I
used
wish I
that.
could just drink a protein shake and sit there and then just gain muscle. That'd be nice. But, you know, and that's where the activation and everything comes into play.
Yeah, I'm gonna have to use that.
Yeah, go ahead.
But so that's great. So now we have a good idea of functional medicine and functional neurology. So we wanted to talk about PANS and PANDAS today. I'm sure if a parent listening to this, they probably have a good idea if their child maybe not has PANS or PANDAS. Sometimes it can be a tricky diagnosis to come to. But can you kind of explain what it is and what are some signs that people need to look out for in their children
Yeah.
with this?
I mean, the way that parents have so succinctly put it to me is, it's like hell on earth. My child changed overnight. I've heard stories of brothers trying to stab their younger siblings in their sleep with scissors, pushing their mom in front of buses. So they can get pretty violent, and all the way up to sometimes it'll almost look catatonic. I've seen some children, and they're not really children. They're starting to grow up. They're like in college and things like that. Maybe just, you know, in this reflection posture on a couch, just like, and they can't open their eyes. They're very non-responsive. And maybe they'll just going through some perseverations, just repeating like, why. And, but of everything that I've usually heard is the kind of the unifying theme I hear is it happened overnight. Like it was like a light switch. They woke up different, or it changed very rapidly. Because when we think of PANDAS, which is pediatric acute neuropsychiatric disorder associated with strep, so we think this fluffy little bear type thing, but it's not. It's very scary. And that one's associated with strep. And they found that one a while ago. So a kid would get strep throat, and maybe they might get some like choreiforms, like twitches and these movement types of things, eyes, verbal tics. Sometimes what I would call like the emotional tic, that swing of violence or that swing of outbursts. Because we know that basal ganglia is responsible for regulating a lot of that too. But then they were like, well, now we can call it PANS because maybe this kid just got the flu. I've seen kids get tick bites and get it. They'll just get sick at school and they'll start to get violent. Maybe they'll get something, so they'll just get sick, like food poisoning. And then so they called it PANS, which wasn't with strep. It was just basically, they would change, but it was just something else. But now they're getting kind of rid of the pediatric side of things because this is starting to happen in older and older populations now as well too. So yeah, it's really not that great, but that's where when we think of those violent outbursts, what we find is typically an immune response due to an infection. Because I think of the basal ganglia like the ultimate punching bag in the brain. It just gets beat up by like autoimmunity and toxins and all these infections. And I'm just like, oh, poor basal ganglia. So we might think it's, oh, well, here's a dopamine or a neurotransmitter issue. And in reality, it's not. It's an inflammatory or an infection or an autoimmune issue.
Absolutely.
And we're just seeing it expressed in the brain that way.
Absolutely.
Yeah.
So what is the typical, I guess, medical route that a patient would undergo if they were to be diagnosed with PANDAS?
Yeah.
And what happens when that doesn't work? Where do you step in then?
Yeah. Usually we'll see maybe a lot of like kind of mood stabilizing type drugs, things like that. That can also be a big clinical pearl where if they try like, oh, here's maybe some Adderall or, or maybe we're getting like a D1 or a D2 agonist and it gets like profoundly worse. Because that's what it used to be, just like D1, D2, which are the dopamine receptor sites. They used to see the immune system would start attacking the receptor sites. So someone might feel worse on those medications. And that would be like kind of a ding ding, oh, like let's rethink this maybe. But now once it's getting more popular. So there might be things like steroids. Some kids will just go through a round of like prednisone or something like that, just to bat down that inflammation. Which, we're natural doctors. We're supposed to be like, oh, medication. But man, if that was my kid, I'd be like, please give them the steroids. I want them to be able to make it through this right now. We don't want that big spiral. Because if it's autoimmune, it's like a flare, right? If someone's lupus or rheumatoid arthritis flares, we don't want to have to take it. I say it's like asthma. You don't want to have to use your inhaler, but if you need it, you really hope you have it. So that's to me the way that it'll be used. Some patients, I work with and co-manage a lot of patients that'll maybe be on LDN, low dose naltrexone, which that more like modulates the immune system. Not all doctors are into that because they'll be like, well, I don't think this kid's a heroin addict, and I'm like, I don't think they are either, but they're thinking like very high doses. Because that's what they'll do for maybe like, rehabilitation and alcohol clinics or something. But what we can find is like, well, hey, this can really modulate inflammation. We're not suppressing their immune system with like steroids, but we're just keeping that basal ganglia from being destroyed from some form of inflammatory, maybe even autoimmune process. Which to me is like a lot better when we look at the list of side effects of that versus maybe like long-term chronic steroid use. And then I think like the risk benefit ratio is huge. So we'll step in and, because when we think of the immune system, I kind of first start thinking of the gut, because that's where, everyone's like, well, 70% of the immune system's in the gut, that whole fact statistic thing. So that's where we'll kind of start there too. Sometimes we'll find other little triggers. Because, we'll find viruses, like everybody has viruses, but back to some of these kids, like other kids at school might get the flu. This kid gets like the flu, but then they also get violent or something like that, potentially. But I've seen mold exposures do it, chemical exposures. One of the moms of one of my kids, she had to find when they were spraying the schools, because those nice green lush fields of grass, that takes a lot of chemicals to keep it that pretty with no weeds. And he would start to have these meltdowns at school on the days and a few days after they would spray with like the glyphosate and all the fungicides and herbicides and things like that. So then she would just have him go out of school those days, work from home. So we don't want to we don't want to blame the body. These symptoms that someone's going through are terrible. And I personally have autoimmunity in my brain. So this is like part of the reason I selfishly learned all this is so the end of my life hopefully sucks a little bit less. But
Yeah.
well, you know what I'm saying? It was at a Carrick module. I forgot who was teaching, but they were like, if everyone lives long enough, they're all going to die of neurodegeneration. And I was like,
Mm-hmm.
because I mean, the only memory I have of one of my great grandfathers is the corn falling off of his spoon
Mm-hmm.
when he's trying because of his Parkinson's. And then
Yeah.
one of my grandmothers, it took her 8 years to die of Alzheimer's. And
Mm-hmm.
I told my wife when my daughter was born, I'm like, I'm cool on that. Y'all are never going to see me like that. Like, I'm going to do
Yeah.
everything I can because we know, and hopefully everyone listening knows, you develop a lot of these diseases much earlier in life. We
Mm-hmm.
just don't see the end stage until the brain can't take anymore after 40, 50, 60 years.
Yeah, absolutely.
Yeah, so that's where we really want to, change that trajectory. What can we eat? What chemicals can we avoid? What nutrients do we maybe need? What little critter hitched a ride somewhere along the way that maybe we need to kick out or at least charge rent or something to, um, so that way we can really make an impact.
Very good. So, so through the functional medicine aspect, you tend to address the gut because that is a huge area where the immune system begins really. And then from there, we talked about the basal ganglia. So what are you doing from the neuro rehab perspective to maybe help the basal ganglia out or wherever you
Yeah.
know see the
Yeah,
problem?
well, I love Stroop. No, I'm kidding. But Stroop is always one of my favorites. No, and that's where, we'll want to like maybe see what's going on and everyone can see the left and the right. So, and that's where like I personally look for like what I was saying, like gross motor things.
Hmm.
You obviously can't see everything over the internet, but there's certain things that I just think like if I couldn't see it, I should probably give up now, type thing. Some things are so glaringly obvious, and then of course y'all see it in the clinic too. When someone just like they watch the nervous system change before their eyes, and they're like, oh my gosh, like you see that like oh my gosh face is what I call it.
Hmm.
Either like wow that improved immediately, but sometimes we'll find actually a lot of cerebellar work. Sometimes we'll find using the frontal cortex. I love to do a lot of dual tasking.
Hmm.
Um, I love dance parties too, because kids like it to be fun. And I'm like, do y'all like to dance? And they're like, oh, I love to dance. And I'm like, cool, maybe have them chew gum for like some pawns and, get some of that integration, and we'll hit a pause button and everybody just stop and freeze. And let's like maybe, when we can think of all these neuro tweaks we can do, like, well, let's freeze for 8 seconds and, all of these little bitty things. But we can really make it fun for a lot of kids.
Yeah.
One of the children that I was working with, he had autism and PANDAS. The reason a lot of them intertwine, actually, it's not uncommon where I'll see a lot of autistic children with PANDAS. And then some of the kids with PANS happen to be like very good at math and things like that.
Hmm.
Um, you know, but anyways, we'll kind of see those going hand in hand. And I was just talking to him. I was like, what do you want to be? He's like, I want to be a ninja warrior. And his dad happened to be an engineer. So in the backyard, they built this ninja warrior course because he had a lot of midline cerebellar stuff. So I'm like,
Oh,
we
very
can do a
cool.
lot of balance, a lot of core.
Hmm.
And every day after school, he wanted to do ninja warrior training. And I mean, this kid like thrived. He went from hundreds of meltdowns a day to now the mom's like, I can't even remember like the last time. And that's where we come up with these little games for patients. Like, what little eye games can we do? Is it, because I love anti-saccades, for example. I think those are
Hmm.
like probably people will be sweating. They'll be trying so hard, these kids, to not look at the thumb that moved, and they're like, I'm sorry. And I'm like, I know. Um, but sometimes it's maybe eye movements aren't the best thing for them. Maybe it's not fun. They start to remember the patterns. It starts to
Hmm.
become a thing. And as soon as a kid argues about doing any brain-based game, I say, then it's over. Let's just find another way to do it.
Yeah.
Yeah. So, and then, if a lot of parents are like PTs, a lot of kids I work with, they're already doing like OT and PT and everything.
Hmm.
And so sometimes like the speech therapist is like, I'm okay with doing stuff. I'm like, oh, very cool. Like, let's do maybe some parietal work at the same time, and we'll walk them through some of the findings. Because it really does take a team and so much integration to get the maybe the healing that we all want for these kids.
Yeah. And I think the PT and the OT are fantastic for these patients. And then what you're able to provide is really, such a huge puzzle piece to, what they're dealing with to really, help progress them along. So that's
Yeah.
great.
Yeah.
That's great. So when a patient wants to contact you, how would they do that? And what does an assessment typically look like with you?
Yeah. So they can find me at becomeproof.com. I can give you links and things like that for later.
Mm-hmm.
But usually we start out with just a little short phone call, 20, 30 minutes. And the space that I come from there is, can I help you? Is somebody willing to do what it takes? And do we like each other? To me, those are kind of the big three things. The minutia after that is, what's maybe the most appropriate test that we want to run? What's maybe some dietary considerations? Because we have like a diet and lifestyle coach. You don't want me making your meal plans, trust me. It would be like super plain and boring. I eat for function. I'm like, did I eat fiber? Like, yes, yes, yes. And I'm like, okay, whatever. As long as it tastes mediocre, I'm fine. Because people need support. Some of these kids are picky eaters, things like
Mm-hmm.
that. So we start there, and then from there it's a 1 hour consultation where we have an intake packet that's pretty thick. I know you guys do really like thorough assessments and everything.
Mm-hmm.
And I just tell people, if we're lost in the woods, if we want to know where we are, sometimes we just need to stop and quit running around. Like, I need to know, like, what got you to today? How did you get right here feeling this way? And if we know where we are, then we have a really good idea of where do we need to start going. If people have already run maybe testing and blood work, I say, why ask if you're anemic twice? You're either anemic or you're not. We already know the answer. Let's ask a different question. Because usually what I find, and usually not in our space or anything like that, definitely not in our space, but if someone's like, oh, I've, keep going to the doctor in the same hospital, I just see sometimes the same tests just run over and over and over. And I'm like, we already know they're not diabetic. Like,
Mm-hmm.
why are we, like, they're not diabetic, like, that's okay. But, and that's where we just want to maybe really get a different piece of the puzzle, because that can completely change the picture.
Mm-hmm. Absolutely.
Yeah.
So we're just about out of time. So I wanted to give you the opportunity to leave us with any final thoughts, any knowledge bits about the topic of PANS and PANDAS. Maybe some common questions that you get asked by patients, that sort of thing.
Yeah. Because usually if the kid's going through a flare, they're like, what can I do naturally as much as I can? Depending on the age of the child, that's where I would honestly say fasting. Stabilizing blood sugar, and if they're older kids, even intermittent fasting. When we think of reducing inflammation, believe it or not, one of the best things people can do is not eat. It's a very intensive process to do that. Plus, when we think of autophagy, or eating things that are broken, we know we kind of got to be in a fasted state. So sometimes the easiest way that we can do that, it will put a fancy label on it, call it intermittent fasting. I would just say, just don't let your kids eat after dinner. Late night snacking is probably one of the worst ways, that, because we think of light for the circadian rhythm, but food intake also drives the circadian rhythm, because we would only eat traditionally when the sun was up.
Mm-hmm.
If we were out at night, we were probably being eaten. So, because it's rest or digest, right? So that's where I would say our body can't rest and digest. It has to choose. So if we want that resting, if we want that anti-inflammatory part of our circadian rhythm, like, we really need to sleep. So we can maybe not snack after dinner, maybe try to delay breakfast a little bit. The old saying is, you can't fix the road with traffic on it. So if we want to quote unquote fix the gut, it's got to be empty. That's only really happens after 12 to 13 hours of the last bite you swallow food.
Mm-hmm.
Hopefully you're starting to get empty at that point. But most people, due to, we know, maybe like for vagal tone or something, their bowel motility is not ideal. So that's something that we'll really do. And don't underestimate the power of diet. The two foods by far I would see would be, the word gluten gets thrown around a lot, but there's a reason that is the child that's maybe responding so negatively to something like a flu or just some sort of illness. The same genes for autoimmunity, like HLA genes, are a lot of what we might consider gluten sensitivity genes. And then we'll also see a lot of casein involved typically. One of the things back to, I don't know if anyone's heard of like exomorphines or gluteomorphines, caseinomorphines. Have y'all heard of those?
Oh yeah, not in depth, no.
That's okay. So those are just through food can actually start to activate opioid receptor sites. So a lot of times parents ask me, what food am I going to have to, like, is maybe a problem for my kid? And I ask them, what do they crave? Because the ones that have been known to activate those kind of morphine, like opioid receptor sites, can be gluten, casein, and then like rice and potatoes and corn. And so usually if the kid's like, oh, they'll just throw the cheese and the bread off and just eat the bread off the sandwich. They'll like throw everything else away, or they have to drink chocolate milk, or they have to have popcorn as a snack. Then I say a person that smokes cigarettes, they crave cigarettes. They crave what's bad for them. Same instance here. So a lot of the times we'll see kids maybe in this inflamed state start gravitating towards what's actually bad for them. Because that smoker, or these kids in this instance, after they eat that food, they'll feel good for about 20 minutes. But then the inflammation starts up again. So that would be like word to the wise, just something very simple you can do to try to not add more fuel to a fire that's happening.
Absolutely. Very good. Thank you very much. I think you've given us a lot of good bits of information today. I think we have a better understanding of functional medicine paired with functional neurology, and all the things that you can do to help with PANS and PANDAS for these children who haven't, recovered. And in addition to PANS and PANDAS, we talked about autism and even PCOS today. So it seems like functional medicine paired with functional neurology has a lot to offer patients, and you're doing a great job by pairing the two together.
Thank you, man. I appreciate that.
Yeah. And just one more time before we go, can you leave us with your website or how to get in touch with you again?
Yeah. Let me get a link real fast. So that's usually the easiest thing to do. Y'all can see me try to dual task right now.
Yeah. This is a good test.
That's always fun. Oh my gosh. You'll just see that arm just like start freezing. I'm like, there it is. There we go. Yeah, that's so we call it an application just because we want to make sure it's a good fit for everybody. It's a good time for everybody too, things like that. I jokingly say now the good news is you definitely don't have to travel. So yeah. But
perfect.
Thanks for having me. I hope everybody learned something and enjoyed it too. So
yeah, I know I definitely enjoyed it, and got a lot of great information from this. So thank you. So this has been your host from the Neuro Wellness Podcast, Dr. Joe. Be well.